So hello guys, देखो ना here we are going to learn about the diuretics. We are going to learn about the diuretics. Please don't skip these topics. As if you are preparing for the FMG and the NEET PG. Okay, so myself Dr. Ajay Maurya. I also completed my FMG exam 2024. Currently, I am done with internship, and also I am also preparing for the preparing for the PG exam. Okay, na. So here, today we are going to learn about the diuretics in the exam point of view. Okay, now you will get 1 to 2 MCQs for sure. Okay, now so these are the questions. These are the PYQs. We will solve this PYQ after knowing about the diuretics. Okay, now after studying about the diuretics. What is diuretic? What is di? Di means what? Two. See, diuretics means what? Always loss or something. Di means what? Two. There is a loss of both the sodium and water. The loss of both the sodium and water. As you note that, I wanna follow. Sodium always follows the water. Water always follows the sodium. Okay, na? See here, we are having that. Let's discuss about the diuretics. How they are going to ask the questions in the examination. First of all, they're going to give this type of images, and they're going to mark A, B, C, anything, anywhere in the nephron, and they're going to ask you what antidiuretic drug is going to act there, or else they're going to give some case scenarios, and they will ask you the mechanism of action. That's it. Okay, or else they're going to ask the side effects. That's how the question is going to be. Okay. So first one, guys, this is the nephron. Okay, now PCT, DCT, collecting duct. In the lobe, we have in the ascending lobe and we are thin and thick ascending limb loop of Henle. Okay, get clear? So we are having the diuretics are divided into non-specific and specific. Non-specific means what, Amma? It can act anywhere of the nephron, but most probably they're acting some places. Example are, that is, first one is the, okay, please take a note and write down. First one, right? First point, osmotic diuretic. It is osmotic diuretic. How example is the mannitol. It act on PCT until it will act on loop of Henle thin. Until here it will act. So it will act PCT and lip in the what, and also act on the thin loop of Henle. Okay, but okay now done now. But mostly we have to mark the answer as the PCT only. Okay, now so what is osmotic diuretic? What is osmotic? Meaning it having the property of what? It will do osmosis. It will do osmosis. It means water loving properties. So okay, now see where it acts on the PCT. Done. One question. What is the uses of the mannitol? It is used in the treatment of what? Cerebral edema. Cerebral edema. If there is edema, if you give the IV mannitol, what will it will do? It will do what? It will reabsorb the, it will, from this is the suppose example, this is the blood this is blood vessels, this is the brain okay, now it will secrete the water it will reabsorb the water from the cell, and it will directly reabsorb the water, and then what happened there? Then what happened? The edema will be reduced. So this is what happened is edema now. So it is used in treatment of cerebral edema. It is also used in treatment of acute congestive glaucoma. Okay, now remember, it is also used in the treatment of the partial, means incipient renal failure, not the complete. Okay, now so do you write that one? Tell me what are the treatment of, in what cases we are going to use the mannitol? In the cerebral edema, acute congestive glaucoma, and the partial renal failure. Okay, now where you are going to contraindicate? In what case we are not going to give the mannitol. Example where in the cerebral hemorrhage, because if there is a hemorrhage, the mannitol is going to absorb into the cell, so it may causes the hemolysis. It may cause the what hemolysis. Okay, it will increase the edema sizes, and it also contraindicate in the pulmonary edema, and it also contraindicate in the acute renal failure. Okay, so these are the things you have to remember. Done about the osmotic diuretics. Okay, done. The next one coming to the carbonic anhydrase inhibitor. Carbonic anhydrase inhibitors. Example we are having what we are having the acetazolamide, and we are having the some topicals like brinzolamide and dorzolamide. Example we are having, so these are the examples of what carbonic anhydrase inhibitors. Example acetazolamide, brinzolamide and dorzolamide. Brinzolamide and dorzolamide are used as the topical eye drops in case of the glaucoma. Acetazolamide is as IV or tablet forms. What does it do? It will do the loss of what? Loss of sodium. If there is loss of sodium, obviously there is loss of water also. It also do the loss of sodium and bicarbonates. If there is more bicarbonates going to excreted in the urine, then what happened? The blood pH will be what? Rises. It will cause metabolic acidosis. So that's what happened in the mountain sickness. Mountain sickness, what happens, Amma? There is less CO2 in the high altitude. Okay, na? So it causes what, Amma? It causes the metabolic alkalosis is going to happen in the high altitude. If you give the acetazolamide, it will cause what, Amma? Metabolic acidosis. If it is going to metabolic alkalosis, then only there is going to be what, Amma? Breathing problems. So acetazolamide is going to drug of choice in the case of the mountain sickness, as it causes the metabolic acidosis. And it also used in the treatment of the acute closure glaucoma, and also to use in the treatment of alkalinization of the urine, and it is rarely used in the treatment of epilepsy. What are the side effects here? It causes bone marrow suppression. If you take longer time, it causes paresthesia, kidney stones, and hypokalemia. Remember one thing, it is contraindicated in the case of the liver failure, as it increases the chance of hepatic encephalopathy. That's why it is contraindicated in the liver failure. Okay, now these are the points you have to remember about the osmotic and carbonic anhydrase inhibitors. Done. Now coming to the proper specific one, we are having the loop diuretics. See here, where does loop diuretics will act? It will act at a thick ascending limb of loop of Henle. This is the thicker one. What it will block the sodium potassium 2-chlorine symporter. It will, if you block this one, what happens? It will everything is going to be lost. So that water also is going to be lost. Okay, now this is the thick, this is the loop diuretics. This is called as high ceiling diuretics. Among all the diuretics, this diuretics, if you give smaller dose also, it will excrete the water more. That's what is called as high ceiling diuretics. We are having the examples furosemide, torsinamide, vitaminide. These are the loop diuretics we are having. Which is the longest one is the torsimide. Okay, na? So here, what are the side effects here? Side effects of the loop diuretics. See, loop loses everything. It causes hyponatremia, hypokalemia, hypomagnesemia, okay na, hypocalcemia also. It causes the hypocalcemia. It causes the hypocalcemia. That's why it is used in the treatment of what, ma? Treatment of hypercalcemia. If there is hypercalcemia, then you can use the diuretics. Okay, na? Okay. It causes the hypokalemia. That's why we can use in the treatment of hyperkalemia also. In the hyperkalemia, you can give use the loop diuretics. Okay. So in the end, it also causes the side effect at the watama ototoxicity. It is ototoxicity. It is also a ototoxicity. Okay, na? That at where you are going to use the loop diuretics in the pulmonary edema, hypertension emergency, hypercalcemia, bromide and iodide poisoning, and acute heart failure. Not chronic, it's acute heart failure. So there are things you have to remember about the loop diuretics. Got it? Got it now? Yes. Next one. Next one is we are having the thiazides drugs. Thiazides, where it's going to act at the early part of the what? Early part of the what? Cortical descending, what is the one? Distal converted tubule, DCT. Early part of the DCT. Is going to act here. It will going to block what? It's going to block the sodium and chloride channels. Okay, na? So it's going to inhibit the sodium and chloride reabsorption at where? Early DCT. Okay, na? Here, guys, coming to here, both loop diuretics and the thiazides, both the loop diuretics and the thiazides causes the what, causes everything. Hyponatremia, hypokalemia, everything is the same one. But one thing is the difference is that, guys, it causes hypocalcemia, but it causes hypercalcemia. Okay, loop diuretics causes hypocalcemia, but thiazides causes hypercalcemia. That's why it causes hypercalcemia. That's why it used in the treatment of the osteoporosis. Osteoporosis. Got it, ma? Got it? Okay, now it also causes the hyperuricemia. It also causes the loop diuretics also causes the hyperuricemia, but more with the thiazides. Okay, now remember, it is thiazides is the drug of choice for the hypertension. If they are not going to give any comorbidities, if they are going to ask you simply what is the drug of choice for the hypertension, just mark thiazides. Okay, then okay, super. It is also used for the treatment of what, nephrogenic diabetes insipidus. Diabetes insipidus, we have the two types: central and nephrogenic. Central means what, Central means what, It is due to, it means ADH is not going to produce. Okay, na? ADH is not going to produce. That's why you have to give the ADH hormone, vasopressin. The best one is you have to give the desmopressin for the central. For the nephrogenic means what, means ADH is there, but it's not going to utilize in the proper way. That is the nephrogenic. So drug of choice is the thiazides. Okay, done. Okay, now. And also remember what can remember we are having the chlorothiazides, methiazide, hydrochlorothiazide, and also metallazone. So in patient with CKD patient, metallazone is the drug of choice. Okay, na? This is what. Done, na? Perfect. No more doubts here. Okay, na? So next one is next one here, see. Next one, we are having the potassium sparing diuretics. What am I? Potassium sparing diuretics. Okay, so potassium sparing diuretics are two types. Which first one is the what am I? Aldosterone receptor antagonist and epithelium sodium channel blockers. Okay, na? So we are having the sodium, potassium, okay, na? And hydrogen. Okay, na? Sodium, potassium, and hydrogen channels here. Okay, na? So if in order to work this one, guys, we are having the what am I? Aldosterone is must and should. It must be active. That's why it will act. Okay, now if you are going to block, so okay, done. This is now. And can you tell me what are the drugs associated with the aldosterone receptor antagonist? It means they're going to block the aldosterone. It is here. It is the spironolactone and eplerenone. Tell me spironolactone and eplerenone. Spironolactone and eplerenone. What are the drugs is going to what block the ENC means what epithelial sodium channels? It is the what amiloride and triamterone. It is triamterone and amiloride. Triamterone and amiloride. So okay, they're going to block this one. At least you have to know. The thing is that if you're going to block this one, what happens, Amma? The what Amma here, the potassium loss will be decreased. Potassium is not going to excreted in the urine. Although it causes the what Amma, if we block this one, the sodium will go out now. Then water also it follows the sodium. It causes the diuresis. But one thing remember, the potassium will go inside only. It causes what? It causes the hyperkalemia. So this is a good one. Among all the diuretics, everyone is causing hypo. But this potassium spared diuretics, this causes hyperkalemia. So this is very good for. Okay, so okay, that's what. See here, one thing you have to remember about here, see, potassium sparing diuretics, it also blocks the testosterone in the males, and if also in the male, it causes what gynecomastia, and the female, it causes the PCOS. Okay, it causes the PCOS. As you know that there is in PCOS there is there is a hysterism. So okay, and that's why it is and that's why the potassium sparing diuretics is also used for treatment of the in females. Sorry. Remember here, in males, it blocks the testosterone in males, but in female, it is the drug of choice. Okay. In males, it causes the gynecomastia, but in females, it is the treatment of the PCOD. Got it? Don't confuse now. Tell me. In males, it causes gynecomastia. Example, it is more with the spironolactone, not with the eplerenone. If there is any question, as we know, the spironolactone causes the gynecomastia. Is there any other drug which cannot cause means? Okay, eplerenone. But in females, it is a treatment drug of choice for the PCOD. Okay, now where you are going to use the potassium sparing diuretics? It is in the case of the what? Cirrhotic edema, liver cirrhosis edema. Okay, Cohen syndrome. Okay, chronic heart failure. It is congestive heart failure. Next one is the resistant hypertension. Okay, resistant hypertension. In these cases, we are going to use the potassium sparing diuretics. And for the treatment of diabetic nephropathy, there is one drug is called as the finerenone. It is the finerenone. This is the new drug. That is finerenone is the new drug for the treatment of the diabetic nephropathy. Okay, done. Coming to the inner blockers examples we have in the amiloride and the triatom. Just remember the seat the mnemonic seat. S for spironolactone, E for eplerenone, A amiloride, T for triatom. For remember how to remember the sparing diuretics example. C take the mnemonic, or you can remember the paste is the mnemonic. Okay, but you have to know which is the inner blockers and which is the aldosterone receptor antagonist. Okay, and remember here, amiloride is the used as treatment of the lithium-induced diabetes insipidus. It is also used in the treatment of nephrogen diabetes. It is also used in the treatment of the Liddle syndrome. Okay, Liddle syndrome. Okay, so this is the thing also you have to remember. But you have to remember All this causes the hypokalemia, but it is causes the hyperkalemia. That's why whenever the patient is on the hydrochlorothiazides, anything, we are going to add the potassium sparing diuretics, so for example, spironolactone, as it cannot cause the hypokalemia. So that's why you have to maintain the potassium levels in the body. Okay, na? So this is what this is all about the diuretics. No? Can you solve the MCQs? Are you ready? Are you ready for the MCQs? Okay, tell me what are the drugs causes the gynecomastia in males? Example is disco. Okay, pneumonia is disco. Please comment in the below. Thank you. The next one, let's solve the questions here. These are the PYQs here. Okay, solve with me. Let's see how I am solving. A 35-year-old male experiences headache, nausea, and shortness of breath while trekking. See, while trekking means he was going what? Some higher altitude. He was going to something layered, something. Okay, now the physician prescribed. Okay, the diagnosis is what? Mountain sickness. Then what is the drug of choice? Estrazolamide. Estrazolamide, where it acted? It acted where it had PCT. Where PCT. So the answer will be what? PCT. Next one. Which of the following conditions is not treated with a high serum diuretics? See, which is high serum diuretics? Examples: loop diuretics. Loop diuretics. So, okay, now edema. Okay, cerebral edema also we can treat. Okay, now this is also treated. But see here. But see here. See, according to the options given here, see, does it is used in the treatment of pulmonary hypertension? No. No. Pulmonary hypertension? No. We are having the drugs like sildenafil. It is prescribed for the treatment of the diuretics for the pulmonary hypertension. Okay. Next one. A 50-year-old woman was prescribed diuretic by a doctor to manage patient. Okay, hypertension. Okay, na. See, even though if there is no image, meaning there is no image, also you have to keep the answer. Okay, now hypertension. What is the drug of choice? Thiazides. Thiazides. Okay, thiazides. Now see the image here. Thiazides. A option. DCT. Oh my goodness. DCT part is thiazides only, na. See. Next one. Which of the following subsequent medication can lead to the development of gynecomastia? Oh my goodness. I told you now. What is the mnemonic? Mnemonic is what? Disco. What is the disco dancer? Disco dancer. D for what, amma? I for what? S for what? S for spironolactone. Tell me the other one. Okay, na? I will wait for you. This is your choice. This is your what do you call the homework. Next one. Next one is the here. Just try to match the column A and B. Tell me. Estrazolamide, where it acted? Estrazolamide acted where, amma? Where estrazolamide? PCT. Next one. Torsemide. This is the torsemide. Where at a thick ascending limb. Where? Thick ascending limb. Next, vasopressin ADH. Where, amma? Collecting duct. Next, chlorothiazide means it is a what? Chlorothiazide where? It is a descending distal DCT. Done. Next one. Next one. Which of the following diuretic is matched correctly with matched correctly? See, osmodiuretics, where it will act, ma? No, it activates PCT. Isn't it? PCT. Next, thiazides, DCT. Carbonic, yes, correct. Potassium spirit, correct. So 3 and 4 are correct. Next one. A patient was brought to the hospital following road traffic accident. The patient was disoriented, city head sore, No evidence of hemorrhage. Okay, no, see here, there is no hemorrhage. Okay, cerebral edema. And also, which of the following can use for the initial management of raised ICP? So, as ICP concerned, the drug of choice is what? Cerebral edema. It edema, it causes the ICP. The drug of choice is going to be what? Mannitol here. Going to be where? It's going to be mannitol. It's going to be what? Mannitol. Okay. It's going to be mannitol. Okay. You can ask me one doubt. Hey, why you mark a cerebral edema here? Because according to the option you have to go. This is the wrong answer. That's why I mark this one. Okay, mannitol. It is contraindicated in the hemorrhage. If there is a hemorrhage, then you have to contraindicate the mannitol. Okay. Next one. This is the one. Patient on lithium developed hypertension. He was started on thiazides. Hypertension. Okay. This is see what are the side effects of lithium? Tell me. Lithium side effects of what? L for what? Leukocytosis. I for insipidus. Diabetes insipidus. T for tremors. H for hypothyroidism. Okay. H for hypothyroidism. Okay. Okay. U for upset. It means stomach upset. Okay, now M for what? There is a malformation that is called absent anomaly. Okay, now lithium. So here, what happens, Amma? It causes the diabetes insipidus because when you give, okay, now when you give the lithium, when the patient is on lithium, when the patient is on lithium, and when you are going to give the thiazides, if the patient is on hydrochlorothiazides, and you are going to, example, suppose a patient is on lithium. Lithium is a mood stabilizer. Okay, lithium is a mood stabilizer. He was on lithium, and a doctor prescribed him the thiazides, hydrochlorothiazides, telmisartan and hydrochlorothiazides. What is happening here? The thiazides is going to increase the tubular resorption of the lithium. Oh my goodness. Going to increase the tubular resorption of the lithium. That's why it calls the diabetes insipidus here. Okay, now that's why you have to always avoid the thiazides. Okay, now so you have to always monitor the lithium levels. Okay, Ray, tell me here. D for what, amma? Digoxin. I for isoniazide. S for spironolactone. L for C for cimetidine or ketoconazole. O for estrogens. Okay, done. Thank you very much. So guys, if you are going to make any mistakes in a day, this my half an hour session is going to waste for you. Please don't make any mistakes in the diuretics. I will hurt a lot. Okay. Thank you very much. PDF is going to be in the link. Okay, na? PDF, I will just keep my group link and you can join there. Thank you very much.